Dr. Molly Burrets is a clinical psychologist with 16 years of experience in psychotherapy, research and teaching, specializing in women's wellness and couples therapy. Her own journey, calling off and later rekindling her engagement, navigating infertility and IVF, raising 2 children, and overcoming a serious spinal tumor, deeply informs her compassionate approach. Now an adjunct professor at the University of Southern California, Molly empowers clients to find meaning, resilience, and authentic connection, believing that healing is possible for anyone willing to engage in the work. Thank you so much for joining us. I've already enjoyed a sort of pre-conversation with you, which is, which really tells me this is going to be a really interesting and engaging conversation. So, you're very, very welcome.
Thank you. I'm really glad to be here.
I wanted to start, if it's okay, by just taking you back a little bit, just to understand a bit about your upbringing, your formative years. What were you like as a teenager? Would your 14-year-old self recognize the person you are today?
So my growing up years, I would describe as chaotic.
Okay.
I'm from a pretty big family. So there's my parents, 4 kids, and we also lived with my grandmother and grandfather. Sometimes we had a cousin living up with us. And so it was a big family system with, not always enough resources to go around. And there was a lot of difficulty and challenges in our home. Extremely loving parents, extremely committed, dedicated parents, but with a lot to manage. They had difficult lives themselves, and they did an amazing job giving us a better life than the one that they had. But they were wrapping their arms around a lot of difficulty. And so I really sort of grew up in the mix of all of that. It got me really interested in relationships because what I saw was a family with a tremendous amount of love and a lot of difficulty. And so how do you navigate that? I became really interested from a young age in how do we do this life together as a family system? And I think as a child, I, in general, had like a feeling that the world was kind of a scary place, and I had a lot of anxiety. I had a lot of separation anxiety. I had a really difficult time going to school. I had a very, very difficult time going away to college. In fact, I almost dropped out of college because I was so homesick. I had such a difficult time with the separation. So no, I could have never, as a 14-year-old, imagined my life now that I would move across the country. I grew up in Buffalo, New York. I've lived in a lot of different places. I've lived in Boston, Chicago, Paris, France, Texas, and now I've been living in California for the past 11 years. I never imagined that this would be possible for me as a kid that had a difficult time even just going to school and saying goodbye to my parents for the school day.
It's amazing to think you've sort of from that time where school was an emotional struggle and a cause of anxiety that you've decided to spend so much time educating yourself and get into the sort of learning stage you are now. Where do you think you found the resilience to stick it out at college? And the reason I ask that is quite relevant. So my daughter's 18 and she went off to college about 6 weeks ago.
Oh,
And
wow.
she's living it. Actually, I collect my son is 15, went up to spend a weekend with her, and she's loving it, and she's really enjoying it, and she's settling, and she's loving it. But I do sometimes think what it must be like, especially now, going away from home, leaving all the comforts that most people are fortunate to have, and just turning up at a strange place with lots of people you don't know. How did you stick at it? What made you see it through, do you think?
Well, what happened for me was that although separating from my parents was very scary, I was extremely fortunate in that my experience going to school, when I got there, I had wonderful teachers, and I really grew into my most authentic self because academics were where I shined always, my whole life. And they were how I got attention. They were how I got a sense of purpose and meaning and curiosity and interest. And so when eventually, if I stuck it out and stayed at school, what happened was I got these steady sort of relationships with my teachers and peers that felt unstable at home.
Okay.
and I had opportunities to really thrive and shine. And that's how I got attention at home. I would perform very well at school. And then amidst all the chaos at home, I could sort of be this bright light and bring home good grades and get, really great feedback from my parents and find my identity in that way. So school for me became a safe place for me and a place where I really felt good about myself. So even though it was always hard for me to leave, the experience of having that once I got there was truly what got me through. And both my parents, by the way, were teachers in their lives. And I think that teachers, and I know for me, they have the most incredible impact when they show up as their best selves. When it goes well, teachers completely transformed my life. And I've always had incredible teachers my whole life. And that has been a major game changer for me. That's how I stuck with it.
Yeah, it's funny, isn't it, how so many people, thankfully, at my age and older, could recall their teacher who had an impact. For me, it was Mr. Clark and Mr. Humphreys. The two of them together, they didn't know it, but they had a real impact on me and what I thought and my self-belief and all those things. And I just think, yeah, it's such a big, big thing if a child just has one teacher that sees something in them that perhaps they haven't seen themselves before, or perhaps listens to them when they haven't listened to before. And it's it's and I have friends and friends of friends that are teachers, and I can't think in some ways of a harder job, a more responsible job, but it does have such an amazing power, really. So having some parents that were teachers, going to college and learning and enjoying the sort of education journey, might have been expected to sort of follow their footsteps. What was it that guided you into psychology, and particularly clinical psychology? What drew you to that particular area of life?
I think I had a lot of anxiety about relationships because of some of the chaos and difficulty in our home. And I used my strength, which was academic talent, to get a hold of that and try to control and understand relationships. And that gave me a sense of grounding. If I could understand it intellectually, if I could know what was going on, then I felt a greater sense of stability. And, I really wanted to pursue that as far as I absolutely could. And in fact, when I started my PhD program, I went into my PhD in clinical psychology knowing that I wanted to specialize in couples therapy. And the teacher that I worked with in the program that I went to, he was world renowned for his research on couples therapy and his clinical expertise. So I went to Texas to study with him. And, I always tell people if he took me into the program, I would have gone to Alaska to study with him. His name is Douglas Snyder, and he's world renowned for what he does. And I'm so fortunate to have had that opportunity. And what I did was I took the thing in life that created anxiety for me, and I studied it intellectually to try to get some mastery over it. And I always, throughout my 20s, I struggled in relationships, especially in romantic relationships. I always had a sense of insecurity and neediness in romantic relationships. And the more I learned about this from an intellectual and academic standpoint, the more I could sort of translate it into my own life. And then when I started working with couples, a tremendous amount of healing came from that too, because I was able to sort of embody and give out to other people what I sort of needed the most. And it was this gradual process of helping others heal, helping myself heal. I think this idea that we have to be completely healed ourselves in order to help other people is totally false, that the healing can happen concurrently. And in fact, there's this concept of the wounded healer. Somebody who has a wound themselves is in a unique position to help other people explore that wound and make changes because they themselves have a unique empathy toward that experience. And I think people always think of couples therapists as having perfect relationships. That isn't true for me. It was the area in which I struggled the most. And now I'm incredibly fortunate and blessed that healing and work has translated into me being in a really beautiful marriage. But I like to say that all the lessons that I learned about relationships, I learned the hard way.
And you talked about the happy marriage you're in now, but I know that your relationship journey is anything but typical. So you and your husband were engaged, call off the engagement, reconnected, raised two amazing children. How did that experience? Did that experience reshape your beliefs about what love, intimacy, relationships, second chances, what it's all about?
Absolutely. I had this idea in my head. I really was ascribed to these relationships where there was a tremendous amount of passion and desire, but there was very little stability. And I
Mhm.
found myself sort of having the same relationship with a different man throughout my 20s. And so by the time I got into relationship with my husband, he was a very different man and he was offering me commitment, stability. And I told myself this feels very unfamiliar and I thought that maybe that there was something wrong. I often found myself sort of pushing him away because the experience of him being so available to me was unfamiliar. And I kind of told myself this story that, oh, it should be more exciting than this. I should feel more passion and desire and drive. And so I told myself a story that something was wrong. And in fact, something was wrong. And what was wrong was me. I needed to work on myself and examine the part of myself that sort of had this need to be anxious in a relationship in order to feel that it was fulfilling.
Mhm.
And I really needed to challenge that. And that breaking off of my engagement, I did that because I felt so deeply ambivalent. But during the time that we were apart, what I realized was that he was probably, second to my dad, the only man in my life that had truly offered me consistency, commitment, and actual real love, you know? And the time that I spent apart from him, I was working on myself, I was going to therapy, and it became increasingly clear to me that I had given up sort of the most incredible gift I'd ever been given. And I never stopped missing him across a couple of years. I never stopped missing him. It always felt like a hole in my life. And once I had examined this part of me and really did some healing around this, I I really tried to go back to him and share with him what I had learned. And again, it is a testament to who he is and his commitment to me that he heard me out and he still loved me and he still wanted to be with me and we reconciled. And our relationship is completely different now than it was before. I feel deeply satisfied. We, of course, like any couple, we have our themes and difficulties that we revisit all the time. But it is an enduring and profound love that is not just rooted in that feeling of falling in love and that overwhelming desire. Like, believe me, that's there. That desire and that passion is there, but it's not the definition of the whole relationship. And what I had
Mm.
to learn was that for me is not actually the most important overarching theme that needs to be present in a relationship. I need to have that to some degree, for sure,
Mhm.
but it's not the defining feature that I'm looking for in a relationship anymore.
And how long have you been together now?
17 years.
Well, something's working then.
Yeah.
I always wonder what it must be like sometimes to be married to a relationships specialist. Whether your husband or husband sort of feel, oh my gosh, here we go, she's got a therapy head on again. You must have to somehow try and, the wrong word, but divorce your professional self from your personal self, because you can't be analyzing everything every minute of the day, can you?
No. And, people ask me this a lot. I get this question a lot. And I'll be honest, for me, it comes kind of naturally
Yeah.
to be able to turn it off. I do, this is my professional life. And I really step into this role and I love this role. Um, but I have different aspects of self. And it's not who I am when I wake up in the morning. It's like it's a wardrobe that I put on and it's one expression of myself, but it requires me to um I have to be in the room taking care of other people And that requires you to have a certain level of authority in yourself and in the room. And when I wake up in the morning, I don't want to feel like I'm the authority in my relationship. And I don't feel that way. I can be vulnerable. I can be my broken self when I need to be. And so I think it's really just about having different places in your life where different aspects of yourself get expressed.
So I know you were through the phase being together, being apart, getting back together again properly, and recognizing this is the right person for each of you to be with. So smooth sailing all ahead, but then you had to navigate infertility, IVF, and how does that impact a relationship?
In every single aspect imaginable. First of all, when you go through something like that, both people inevitably are dealing with grief and loss, right? Then you're dealing with the physical challenges of it. Most people who do IVF, it's a myth that people who do IVF are just people who just can't get pregnant. A lot of the time, and in my case, it's people who experience repeated pregnancy loss.
Yeah.
And then they do IVF in order to support them having a baby from conception all the way to birth, right? And so many people who you're either experiencing the loss of pregnancies or you're experiencing the loss of the life that you thought that you were going to have and the happiness, the ease, the joy that you thought you were going to have. It takes a tremendous toll on the physical body. It takes an emotional toll. It takes a huge financial toll. And so at the time that you're going through, maybe the hardest time of your life, you are also quite literally having to pay for it. And so there is more demand on the people in this marriage because you have to make the money to pay for it. You're going through emotional loss. Your body is going through physical changes. You're facing all of your fears and the biggest fear, which is, of course, that it's not going to work. And that's just a tremendous amount for two people to both have to go through at the same time. Other difficulties in marriage, one person can kind of bear the load and then the other person is vulnerable. This is an experience that affects both people at the same time in different ways. So the bandwidth is greatly reduced and the toll is very, very high. So it's a really difficult thing for couples to have to navigate.
Well, thankfully it was successful and you have lovely children now. But what if we can't? What if we lose them? What if we have to do this, have to do that? And that's one of the challenges, isn't it? That we have these stories on our head about from childhood, and even from couples do come to you and talk about their fertility struggles. And I guess the questions come up around: do we go for one more round of IVF, or do we not? Do we get an extra mortgage on a house to sort of pay for this without any guarantee of success? How can you possibly advise somebody? How do you help them come to what is a life-altering decision ultimately?
Yeah. This is another way that couples struggle is because sometimes the course that they want to take, they're not in alignment. One person wants to take a certain course and the other person wants to take another. So I'm glad that you brought this up because that's another way that couples can really, really struggle. I'm in my professional life in doing therapy with couples. I try not to be an advice giver. I am not the authority on their lives. I can offer wisdom. I can help them manage a process where they're sorting it out together, but people must come to their own conclusions. Sometimes that means grieving the idea of what they thought it was going to be so that they can be open to something else. I think about that. Everyone has this idea that IVF is a sure thing. That's absolutely not true. I was given a between 5 and 8% chance that IVF would work for me. And so that has to do with many factors. One of them was my age at the time that I did it. It doesn't work for everyone, but you have to grieve the loss of what you're experiencing in order to consider other paths. And sometimes the work in therapy is about grieving that loss. Sometimes the work in therapy is more solution oriented, like, okay, we want to do this, but here are the obstacles. How are we going to get over them? And so I can serve as more like a coach, helping people to see the possible avenues. And then once they choose one, okay, how are we going to get across the hurdles? We're going to change this about our lives. We're going to make this compromise. We're going to make this sacrifice. And I can help couples manage those conversations that are often very, very difficult to do on their own because they're so emotionally laden. Mm-hmm. And then I would say that finally, a big piece of it that no matter what stage couples are at in the process is learning what the other person needs from them and what they don't need from them. You know, I think there's this very common pattern where, especially in hetero couples, men are more likely to try to want to fix things, and women are often just wanting to be heard, wanting a space to vent. And, you know, men are our providers and our protectors in many cases, and they want to be able to solve it. And so when men come in with this idea that I'm going to fix how you feel, I'm going to solve this, it can end up working against them because, you know, women often feel like that's not what I need right now. The solution is not what I'm aiming at. What I want is to feel connected and heard by you, and that you really see me, that you really understand my experience. And by trying to fix it, it's almost like you're taking away my experience before I've had the chance to share it. So I try to work on those dynamics with couples, figuring out, what does your partner need from you? What are you doing that's working, and what's not working, and how can you adjust? How can you communicate your needs? And irrespective of where they are in this process, that kind of deep work is going to help a couple no matter what they're going through in their life, no matter what phase of life that they're in.
It's fascinating you say that, because I can completely recognize that trait. If my wife might come in sometime and she's just start talking about work or about a colleague or about a situation or whatever, and I think I'm listening, and I'm not trying to say how terrible I am. I'm listening, but as I'm listening, I'm trying to think, right, so how are we going to fix that? Right, what's the answer then? And then we'll get to the end of the conversation. My wife will sort of step away and be like, right, so what do you want to go out for dinner? I'm like, but we haven't fixed it. We just or even this. Tell me, it took me a long time just to recognize, and even now, I sometimes struggle with it. Yeah. That actually the process of verbalizing the situation or just talking about it or sharing it almost is enough for my partner. They're not necessarily often. They haven't started the conversation by saying, right, I need you to fix this. Let me tell you what's happened. They're just saying, let me tell you what's happened. And I'm like, right, so what? Like, okay, well, that's it now, move on. And it's very hard. It's almost like walking past the garden gate and seeing it's off its hinges. I want to put it back on its hinges. I don't want to walk past it. How is that going to... My wife said, well, but it's always been broken. Why try and fix it? It's not going to change anything. And that is a... Yeah. Do you think that's very much embedded in our gender then?
Absolutely. I think the male and the female brain are quite different. Mm-hmm. And so not only do you have biological differences, but then you have how people are acculturated. And, you know, I think men really they are acculturated to minimizing emotions and maximizing solutions. And that's how you become, in many ways, a successful man in the working world. By the way, a lot of times it's how you become a successful working woman in the world, too. It's a very capitalist phenomenon. But I think it takes our biology and it sort of accelerates it and amplifies it. And so, I mean, there's a reason why we find these dynamics present in Western couples around the world, you know?
You see, yeah. It's interesting because part of me thinks about, I guess, the rationale behind one. It sounds terrible. Wanting to fix it is, well, we don't need to talk about this anymore. We talked about it a bit. I'll fix it. Then we can move on from that one. But yes. How do you find the dynamic is then in same-sex couples? Is there a similar? Does one person tend to lean into that trait more than the other person, or I guess two men or two women, or however it might work?
What I think is, one of the things that is so special about same-sex couples, if you look at them throughout history, by nature of the context of their relationship, they have had to kind of create their own rules,
Yeah.
form their own community.
Mhm.
And I think the flexibility that you find in same sex couples is really awe inspiring, that they're able to sort of make, not only are they able to make their own way, but they are required to make their own way, that is a burden that they carry, that they're not walking a trodden path. But there's also a way in which I think that can be incredibly freeing, right?
Mm.
But I do find that even in same sex couples, people, we have this tendency as human beings to become polarized on issues.
Mhm.
If you want to make someone side with you or agree with you, the last thing you should try to do is persuade them. Because it has been shown in social psychology studies for years that when you actively try to persuade someone, they are more likely to go away and to become more polarized against your point of view. The way that you can actually get someone to be more closely aligned with you is to hear their position. And of course, we've really forgotten this, especially with how divided we are politically in the Western Hemisphere. Um, and so, I think there's this freedom in that same sex couples really get to make their own rules. But then there's also this way that they are burdened and marginalized because they have had to do it for so long.
Mm. It's really interesting. 'Cause I do think politicians, as an example, are aware of that. But I think the approach they take is to say to people that follow them, or that the other side isn't listening to you. They're not hearing you. They're hearing something. They're hearing things that you don't want them to hear. They are completely opposed to you, etc. So it's almost the opposite, isn't it? Rather than saying, well, we're here to listen, they're there to say the other people aren't listening to you. Not that I am listening, but the other people aren't listening to you. So
Yes.
it is that sort of push into those there's echo chambers, I guess, where we just
Yeah.
hang around with people that believe what we believe and say what we want them to say, which is
Right. And
yeah,
it's a tactic that uses fear to divide people
it
and then
does.
get power.
Yeah. It sounds very, very I'm gonna say it sounds very Californian, but it sounds very sort of it sounds very out there to say that love has much, much more power than fear, but there doesn't feel like
Mhm.
there's not that much love in politics or in business or yeah, anywhere right now. Um, so you came through that situation. You were successful in having two wonderful children. But I wonder if you're, and it's safe if you're not. But I know that you recently found out you had a spinal tumor and underwent surgery for that, which is a yeah, it's just even hard to conceive. I just wondered if you could, yeah, talk a little bit about how that manifested, how that felt, how the treatment was, and how that impacted the relationship with your partner and your children, I guess.
Yeah. Well, some of the take homes for me are that in our medical system, you really, really have to advocate for yourself. And I learned that, and I learned that the hard way, because I had been having pretty serious symptoms for 2 years before I ever was sent to get an MRI to see what was going on with my neck. And I had a tumor at a very sensitive location at the base of my brain, right on in my spinal column. And so it was very dangerous. And I was experiencing, I mean, I had chronic pain for a long time. This tumor had been growing for years without me knowing it. But I sort of became disabled. I lost the ability to use my fine motor skills. I lost the ability to handwrite. Doctors kept telling me, oh, you must have carpal tunnel syndrome. And my concerns were being minimized. I was told by doctors that, these are signs of aging. And I was talking about my level of fatigue. I remember saying to multiple doctors, I just feel like my nervous system is fried. I said that so many times. And in fact, my nervous system was fried because my tumor was so large that it was causing my spinal cord to be completely compressed to the left-hand side. And I had a very small child when this tumor was diagnosed. My daughter was only 18 months old. And so it was a very difficult time. What I know now is that there is there's growing evidence that shows that taking female hormones in heavy doses can create these kind of tumors, can cause these kind of tumors. And then as part of my IVF treatment, I was taking something called human growth hormone. And that was to improve the quality of my eggs. Well, when you're taking something called human growth hormone, that makes things in your body grow. That's what it's designed to do. And so when you're taking human growth hormone as well as female hormones that are playing a role in tumor development, it is a perfect storm. And I only know that now. I didn't know that before. And so it is even more atrocious that, medical doctors were dismissing my concerns and minimizing them. I should have had an MRI much, much sooner than I did. So that's part of it, is like, as a person, I think as a woman especially, you really have to advocate for yourself. And I know that now. But what I learned about relationships from this experience is everything that I went through with, breaking up with my fiance at the time, getting back together, getting married to him. It was all so much an affirmation that I had chosen the right partner for the right reasons. Because when you're in an ICU and or even prior to that, we had to complete our trust and will because we didn't know what was going to happen in this surgery. There was a total possibility that I would end up paralyzed or worse. And we were preparing for the worst possible outcome while trying to maintain a lot of optimism about the best possible outcome. And let me tell you, you want to be with the person who's going to never leave your side and hold your hand all night long through the ICU, that's the person that I married. I married the person that was not going to give up on me, that was not going to leave my side, that was not going to abandon me, that was going to walk through the fire with me. And that's a big one of my take homes from this experience, is like, that is what really matters in a marriage. And that is what you need to be thinking about when you're choosing a partner. I always say, if you want a lifelong partner, you have to be thinking about a long life. What's going to matter to you in 10, 20, 30, 40, 50 years? It's not going to be the same things that matter to you when you're 25. You have to pick someone for the enduring traits, for their character, for their integrity, for their commitment. And I really learned that I'm with a person who will walk through the fire for me and with me. And it was the most difficult experience of my life, and I am still recovering. And there are some things that will never go back to the way they were before I had this invasive surgery. But I am so, so grateful to be here and to know what I know now.
Do you mind me asking what the prognosis is?
Yeah, it's very good.
Is it
So
gone now? Or
the best news was that obviously I made it through this very dangerous surgery. That's the best, but also the tumor was benign. And, I've had follow-up MRIs. It's not growing back. And there's a low likelihood that would ever grow back. But most importantly, I'm going to be getting yearly MRIs for the rest of my life, so that if it ever does start to grow back, I will not go through the kind of pain and suffering that I went through before, that they can treat it with radiation and they can move on it very quickly. So I have an excellent prognosis.
Good. It does. It makes you wonder. You're incredibly erudite, incredibly educated, PhD, incredibly intelligent, with a very supportive partner, etc. And it took far longer than it should have done for the medical profession to listen to you. So there are a lot of people out there that aren't as forthright or as demanding or as educated or whatever, that aren't going to get that support and treatment. And I
That's
guess
absolutely right.
it's hard, and I'm sure it's not. I know the medical system is different in the US and the UK, but in the UK it's not dissimilar in that our general practitioner, our GP, our family doctor, if you like, I think they get on average 3 minutes 40 seconds per appointment, and they whiz through and next, and it's very quick. And I don't blame doctors, because they've had 10 people in a row that have got a cold or a cough. There are 5 more people that have got, feel depressed, and they've got somebody coming in and saying they've got somebody came in and saying they've got a sore neck and their fingers are tingling. Oh, just here's some tablets, here's this, whatever. And it takes quite a forceful patient to demand more, and it takes also a doctor that's willing to sort of spend some time and think, yeah, that just doesn't sound right. Let's investigate properly.
Yeah.
I've no idea how we fix that, and that's not a question, because I don't know how anybody can answer it. But it does feel that there's something wrong with our medical setup, that unless you are literally demanding an MRI and never leaving somebody's door, that you just don't get the care and support you need, really.
Yeah. And I think a big part of it is, there is this hierarchical relationship between a doctor and a patient, where the doctor is considered the authority. And I'm very aware of this with the clients that I treat as well, that as a therapist, I have an authority, and it's very hard to go up against that authority and to say, no, what you're saying is not sufficient. It's not acceptable. And I require more. And I wish that I had done that earlier, but I bought into this idea that, these people are the authority. If there were something more wrong, they would tell me. And I ignored my intuition, which, by the way, everyone has. And you don't need to be educated. You don't need to have a PhD to deeply know something about yourself, which is that something is wrong, And when I finally got the care that I needed, the way that I got it is I changed doctors. I started from scratch, and I went in and I just was such at my wit's end that I started sobbing in her office. And I said, I'm really suffering. I need you to really listen to me, because I'm starting to worry that I have a tumor or something. So something inside of me knew. And when I did that, I am gratefully came upon someone who was actually really willing to listen and believe me. But I had to fall apart and beg for it, and that's not right.
No, and I guess it's again one of the things that's programmed into us somehow, that we're often much stronger advocates for other people than for ourselves. So if you advocate for your children or for your partner, whatever, if it's your children, you're literally you're not leaving the doctor's office. You're camping out there, and that's going to happen. When it's yourself, somehow we almost find it harder to advocate for ourselves than for somebody else. And I think that comes down to empathy, which is what the podcast's all about, really. Which I really do think empathy is an incredible superpower. But I also think, and listen to what you said today, before we even started, is that I do think almost the strongest empathy does come from, sadly, having had some of the experiences or some challenges yourself. I think it's probably quite hard to be very empathic if you have never had any struggles or adversity or negativity. Do you? First of all, do you concur with that? And secondly, what role does empathy play in the dynamic you have with your patients in particular?
Yeah, I totally agree with that. I can tell you from personal experience that I worked with couples experiencing infertility before I ever experienced it myself. And I even considered myself to have a developing expertise in working with couples who had experienced infertility. And let me tell you, my practice completely changed after I experienced it myself. And it absolutely is true that the firsthand lived experience of going through something challenging gives you a window into the experience that you absolutely cannot have without it.
Mm.
And I don't, if I could go back and erase all of that struggle for myself, I would. I'm not like a saint. I'm not sitting here saying, oh, I'm so glad I went through that, right? I wish I hadn't had to go through that. But since I can't change it, what I've always tried to do in my life through the difficult things is make meaning of it and find a way for it to profoundly impact my life and other people's. And I think that's what I've done is I've taken these difficult experiences and I try to translate them into service toward other people. And that's something that I feel is a very sacred space that I have been really fortunate that people have trusted me to be able to do that. I love my clinical work. I love my clients. I have just the greatest esteem and regard for them, and their willingness to share their vulnerability with me and trust me with that is such an honor, such an honor.
Mm. When you're working with clients and you're doing your research, and I'm sure not only in your own life, but you come across trauma and challenge in other people. There are, people are sharing some pretty big things with you. They're not generally coming to you and saying, "Hey, we just thought we'd turn up and say how wonderful everything is." Just sort of share that with you. They're not generally doing that, sadly. And how do you almost protect your own mental and physical well-being? How do you sort of nourish yourself so you're not carrying that with you? Does that make sense?
Yeah, it's such a good question. And if anyone is listening to this and thinking about going into this field, it's a very important question to consider for yourself. For me, the way that I do it is I limit the number of clients that I see. Because I cannot, in my training years, I was required and had to see 6, 7, 8, sometimes 9 clients in a day. I cannot do that. That is not for me a sustainable practice. There are professions like mine, like teaching, healthcare professionals, where avoiding burnout has to be integrated into how you practice. And the system is not set up to help us avoid burnout. Okay. So you have to, again, advocate for yourself and adjust your own life so that you are taking care of yourself so that this practice can be sustainable. And for me, that means I on an average day, I'm going to see about 4 people. And on a busy day, I'm going to see 5 people. And especially after my surgery, I realized that I'm not going to cross over that 5 client barrier anymore. In the past, I would, take on a little extra, push myself to do it. I can do it. This person really needs me, or I need extra income. And I would find a lot of reasons, both to help others as well as myself, to take on more. And what I realized is that wasn't serving me or other people in the long run. So now I have very firm boundaries about what I require of myself. And I see fewer people so that I can show up for them more. An expression that I really love is sort of one of my mantras that I'm committed to is like, commit to less so you can show up for more. And that's really how I live out that value, is by limiting the amount of people that I see. And then I have bandwidth left. I have bandwidth left to take care of myself. I can go and do the practices that I really need to center myself. And I'm not talking about face masks and bubble baths, although those are fun. Those aren't the things that really heal me. The things that heal me are meditation, journaling, boundaries, saying no, exercise, getting 8 hours of sleep. That stuff that's hard to do, it's easy to go, for me, it's easy to go get a manicure. It is not easy to set up boundaries so that I'm getting 8 hours of sleep a night and not overworking, So those are the things that I do to take care of myself. And they're the hard things, but they're the things that work and create the most change.
one of the things you said at the beginning is that when you were younger in particular, you had anxiety, you were anxious. And I think sometimes a lot of people's anxiety is around the fact that they're not showing up for the people how they think they should, or they're not perfect. And I wondered if you almost had to learn to let go of a desire to be perfect or for perfection. Is that something that you had to almost accept that I'm not going to be perfect in every situation, and try and recognize that sometimes good enough is good enough?
Well, the only flaw in your question is that you've phrased it in the past tense. Did I have to do that?
Okay.
The answer is that I have to do that every single day of my life. I am a very high achiever, and I'm a high achiever for a reason. It comes from a very deep core wound in me of wanting to be seen, wanting to be noticed, wanting attention, and learning to survive in the world by
Mm-hmm.
doing impressive things. You know, that came from and comes from a very deep place for me. And so the drive to achieve is still very present in my life. And achieving, by the way, is at odds with taking care of myself sometimes. You know, what's the reason why I have a hard time setting boundaries? Well, because I want to achieve, I want to do more, I want to be more. What I have to come back to is that, and this is really important for me, my most authentic self, achievement, is actually really about how do I live my purpose in the world and serve others. When I'm in that lane, when I'm working to achieve because it's my purpose and how I serve, I can build in boundaries and it's like really doable for me. When I get off the track and my purpose in achieving is to get noticed, to get merit, to get worthiness, to get value, then I know I'm off the track, because that my true self already is completely worthy and totally valuable. And nothing that I do or don't do is going to change that. And so you can tell yourself a lie that if I achieve, then I will be good enough. For me, I have to come back to my best self is functioning in achievement when I am living out what I am born to do, my purpose, and for how I serve others. And if I stay in that lane, Andrew, then I know I can do it. And then it's sustainable. And so I always, every day, have to be bringing myself back to the place of, it's not about getting value. It's about living my purpose.
So if we step forward many years, and we were at your 80th birthday party. Thank you for inviting me. It's very kind of you. What would bring you joy if you heard people saying this about you and the life that you'd lived?
I just want, the number one thing is that I want my children to see me as a stable, supportive advocate in their lives. I want to raise my kids so that when they've made a mistake or when they're in trouble, instead of trying to hide it from me, I'm the person that they go to say, Mom, I need your help. You know?
Yeah.
That to me is the biggest success, because I want to be the person that they come to that will not judge them and that will wrap them in love and support when they need it most and when they're most ashamed. You know, I want my husband to be able to say, this woman stood with me through thick and thin, you know, and she was there for me through everything, through all of my flaws. And I think the theme that is coming out here that I'm just realizing as I'm saying it is that we are all imperfect. And I want to show up as a person that loves my people, not only in spite of their perfections, but almost because of them, because of their vulnerabilities. And that's what I try to do with my clients as well. So I think I want the people that are my people, the people that I love, and that includes my clients, that includes my family, that includes my friends. I want them to see me as a person that loved them in honor of all of their vulnerability and their imperfections, and that I was a person that they could go to and tell the truth to.
That's wonderful. It's it's one of those things that I might have heard and say, yeah. But I think, like you were saying about the lived experience of being a parent, you do think, oh my gosh, if my children go through life and they make a mistake or whatever, then the thought that they come to me would be overwhelming in its positivity. 'Cause you're there as a carer, you're there as a educator, you're there as a disciplinarian. Of course, you can't just let children run wild and do whatever, but you just hope that they always have that trust that no matter what, you're going to be there for them, and just say show up for them and advocate. And I think that's I think if people can go through life with that as an aspiration, wow, that's that's pretty cool. Are you okay for time? This is a couple more things I really want to ask you, if that's okay.
I have a client at 11, so I should probably stop in the next 5 minutes or so.
Sure. Okay. What one to sort of just take away from where we were just now. So one of the things we're seeing quite a lot of growth in is so-called, well, not so-called, but AI so-called therapists. And I wonder if you think we might reach a point where AI is believed to offer the same level of empathy as a human therapist, and what that might all mean. And that's a massive question. So you've got 5 minutes there.
It's a good one. I think many people already believe that. And so, I think that that's the direction that we're going. And, I understand why people are looking for an easier solution. There are flaws in my field. It's very hard to find a good therapist that you're a match with. It's like finding a spouse. It's a very sensitive relationship. It's hard to find a good therapist. And I don't know about the UK, but in the US, therapy is expensive. Insurance doesn't always cover it. And in places like California, many people therapists cannot afford to take insurance because the reimbursement rates are abysmal and you can't pay back your student loans if you take insurance. And so there are all these systemic factors that I can totally understand why somebody would want to turn to AI to simplify the process for them. And so those systemic factors need to be addressed because AI therapy on its own is a very dangerous practice. What we know is that AI tells people what they want to hear, and it does not protect people when they are experiencing suicidal ideation. And you really need a human being to support you, a real human being through that. Now, what I think AI can be great for is supportive practices like AI journaling. I love these. I don't know if you've seen them, but there's some really cool like companion apps that you can use as a companion to therapy, where you're able to journal, or they can ask you pointed questions to help you think about something more and offer an additional space in between sessions. So I think those things are great and supportive. But if we go down the road of having AI completely eliminate human relationship, that's really scary.
It is. It's a little bit in a way, like you were saying before about there's increased evidence about what happens to the human body if it's pumped full of hormones it doesn't necessarily recognize, and I'm sure we could have a whole another conversation about HRT and menopause and all of those sort of things about what that's all like. But it feels similar with AI, that we've got this amazing technology. And I would say it's an amazing technology, but we don't know what we don't know about it.
That's
so
right.
It's a terrible thing. It's almost with AI and how quickly it's developing, etc. There's almost that thought about, just because we can does that mean we should? It's an incredible. My daughter's studying philosophy, so I'll ask her the question. But that's the whole thing. And so, but we can do this, but should we be doing this? And that's a really hard thing, I think. So my final question, but I would love to have you on again, because I've already got another 20 questions that I want to ask you. My final thing is, so what do you? No, let me rephrase that. So after the life that you've had so far, that you've taken so much from, but it's also put you through it quite a lot. Let's not beat about the bush. Do you have a view for what the next 5 years, 10 years looks like for you, or are you right, we'll see what happens tomorrow?
I'm
What
such
is
a
the next 10
planner.
years for you?
No, I'm a huge planner. I
Okay.
have vision boards. I have a note on
Okay.
my phone that
Mhm.
contains a list of every place, vacation or travel spot that I want to take my kids to, and kind of what age I'd like them to be when we go. So, no, I have big, big dreams for my family, for my life, for my career. Um, and that is exciting to me. Like, I am a person that I want to live my life in a very full and meaningful way. And sometimes the way it's full and meaningful is that I don't have a plan and I can be spontaneous and just enjoy myself.
Yeah.
But for the most part, I'm a planner. And in order to accomplish the dreams that I have and to live out the life that I want, it requires some planning. There's some big things that I want to do. And so I'm a planner. I'm in my career. I'm actually right now, I'm developing and I'm going to be launching my own podcast.
Oh, goodness.
And so that's like a really big thing professionally that I've been working on for a long time and I'm so excited about. Um, and that's sort of the next phase for me. So yeah, I've got a lot of big dreams.
Good. Yeah, we should always dream big. And if we think we're dreaming big, dream bigger. Thank you
Yeah.
so much for your time. You've been incredibly generous. And yeah, I really thought this would be an interesting conversation, and it hasn't disappointed me at all. You're fabulous. Just, yeah, thank you so much.
Thank you.